Some people are questioning the vaccine rollout tonight. Complaints from healthcare workers in private practices are piling up because they say they don't know when their turn will come. News 4's Emma Hogue has been digging for answers from the state after hearing from frontline workers who feel left behind.
Right now, BJC says it's still working to vaccinate all of its frontline healthcare workers, and we're learning that's likely the reason other healthcare workers and private, smaller clinics are also still waiting to get the vaccine. But tonight we are getting a clear timeline from the state as to when everyone in that first phase, category 1A, will be protected.
I was told that everybody would be receiving that. So I was also later informed I was advised incorrectly.
Vicki Thompson, an office manager at a private practice in West County, says she tests COVID patients daily. She was hoping their office would be one of the first to get the vaccine, but 3 weeks later, she still doesn't have answers.
I called the CDC. Okay, CDC then put me in touch with Missouri Department of Public Health, who put me in touch with St. Louis County Public Health, who then put me in touch with the COVID hotline.
Thompson is one of hundreds of healthcare workers in both Missouri and Illinois still waiting to get the vaccine. Today, state officials addressed their concerns.
It just logistically becomes harder, and we know that, and we've accounted for that.
During a press conference, Dr. Randall Williams, director of the Missouri Department of Health and Senior Services, acknowledged it's easier to vaccinate larger hospitals and long-term care facilities first before private practices. In Missouri, 450,000 people are included in the 1A category, comprised of healthcare workers and those in long-term care facilities. So far, the state says about 57,000 have received the vaccine. Dr. Williams expects all healthcare workers and those in long-term care facilities to have the vaccine by mid-January.
The numbers may not go as quickly just because it's a lot easier to vaccinate everybody in one hospital than it is 10 primary care doctors in one community.
Meantime, SSM Hospitals says it's working on plans to allow community healthcare workers to sign up and come to their facilities to get the vaccine, although hospital officials say they're still unsure when they're getting another shipment.
It's unbelievable. I would think that the health departments and whatever other types of government employees that we may have should be making it a priority to get all healthcare personnel vaccinated as soon as possible.
We're told Missouri will be getting additional shipments of the vaccine both this week and next, although it is still unclear how many of those doses are coming to the St. Louis area. I did ask BJC if they plan to have a system set up to allow other healthcare workers to come to their facilities to get the vaccine. Right now, they tell me their focus is on their employees. Reporting in St. Louis tonight, Emma Hogue, News 4.